Hey everyone, welcome back to the stream. It has been way too long since I have been on. I am so excited, so jazzed to be back, super pumped up. I just got done speaking at the Coding Fiesta virtually in Florida. So, taking a breath. We're doing the live stream today. Today I am here to discuss with you guys things about the medical coding industry. Things about your exams, schools, CEUs, job search tactics, and more. I have some questions that actually came through from the form that I created to ask questions for in case I need to research them a little bit. So grab yourself a drink, say hi to your friends in the chat, and let's get started with the stream. Hey everyone, and happy Saturday. Happy Saturday to Marissa and to Mallory. It is so great to see you guys here in the chat today. I see BK's already coming in with some questions. BK's also saying, hey, happy Saturday. And actually, I think this one came through a couple of times. So I think the first thing I'm gonna discuss as I'm wedged here in between presentations, I just did the Coding Fiesta, and I think I have another at 3 o'clock for Piedmont, I believe, on auditing. Big presentation day, big live stream day. And hello, hey, hi to Carla Williams, to Cindy, to Max, to A. Phillips coming in, and Vanessa. So one of the questions that I get asked a lot, and I think this has come up multiple times now through the chat and through the questionnaire, is the only school for medical coding in the state is AAPC certified, but will they go with National Healthcare Association? So what I usually say with wanting to be a medical coder, sometimes in billing, they don't really necessarily look for certifications. They're better off. But when we talk about someone who's looking to hire a medical coder, they're going to look for certifications through AAPC or Ahima primarily. Those are kind of like the Coke and Pepsi of the medical coding world. Like when they're looking for the right brand of an employee, they're looking for that branding of AAPC or Ahima, that they have those certifications. There's lots of other ones out there, and nothing against those particular organizations. I don't discourage anyone from getting any credential from any type of organization. However, what I will say is that when you're looking for a job, if you look even on like codersdirect.com, so let me just switch over. I just got my new computer all set up, so I'm still getting a little bit used to some of the settings. But if we go on to like indeed.com or codersdirect.com and we start looking for medical coding jobs, they're going to look for credentials through AAPC or Ahima. There are pockets of places where they will still accept a credential through like the NHA. But if you're looking about being able to apply to the wide variety of medical coding jobs out there, you want AAPC or Ahima credentials like a CPC, a CCS, etc. So like, let's just even look through here. If we look through here, we can see this one, part-time medical coder remote. What credentials are they looking for? Probably, okay. Oh gosh, of course this one's going to be a bad example and not say anything about the CPC. Let's see, remote temporary coding specialist. Oh gosh, temporary coding specialist. They're looking for CCS or CCA, CPC, RHIT, RHIA. If we look here, they're looking for CPC. So it's not, again, not that I'm discouraging you from getting any credentials with any organizations, but if you're looking to be someone who is a good candidate for jobs, AAPC or Ahima credentials are what you're going to want. So another question came through. If I graduate and get my associates, is there a way to just take the test with AAPC or Ahima to get certified with that organization? So the AAPC does not have any hard and fast requirements for their any of their certifications. Ahima does. Ahima has certain certifications like the RHIT or RHIA where they require you to go through an accredited school. AAPC, you technically don't need to have any formalized school training to pass that exam. So if you want to self-study, if you want to do, study guide studies, you want to take an online course through an instructor, you can sit for any AAPC exam. Technically, you could do nothing and sit for an AAPC exam. You probably just wouldn't score very well or likely pass the exam. But those are they're much more flexible than Ahima. They do have some certain requirements. So if you look even at the Ahima website, they do have some outlines about what their requirements are to sit for their various certifications. So for example, the CCS, if we look down here at their eligibility requirements, it says you have to complete courses in the following topics. You have to have a minimum of 2 years of related coding experience applying codes directly, or hold the CCA plus a year of experience, or hold a coding credential from another organization like the AAPC and have a year of experience, or hold the CCSP, RHIT, or RHIA credential. So Ahima more so has some regulations as far as what you need to accomplish before they will allow you to sit for that exam. Marissa B is asking, is the COC test similar to the CPC test? It is pretty similar in that they utilize the same code sets. So CPT, ICD-10-CM, and HCPCS. But what they're going to test you more on for the COC are things like your outpatient prospective payment system, the inpatient prospective payment system, the differentiations between them, as well as some of the payment status indicators. And there's going to be more questions that are geared towards things that would be performed in an outpatient facility setting. So they're not going to ask you about a lot of questions that may pertain to things that aren't done in like an outpatient center, like things like lipoma removals or, same day surgery like gallbladder removals. But they're also going to test you then on some of that stuff about payment methodologies and that. So those are going to be the big ones that they're going to hit. I actually do have a video. I think it's actually a short video where I talk about the difference between the CPC and the COC. So if we look at the main channel page, I do have a couple of COC resources. Let's take a look over here. So search COC. Yeah, so I do have one where I talk about my COC exam experience. And then this one right here, CPC versus COC, is just a short video where it talks about real high level what the differences there are. I'm seeing some congrats in the chat. Who just did someone pass their exam? Abigail. Congratulations, Abigail. That's so exciting for you. Congratulations on passing your CPC exam. Let me know in the chat. Did you take it? Did you do the online version or did you take it in person? It's still tough sometimes, especially at the end of the year. It's usually tough to find exams. I personally try not to do too many in like the December, January, February, only because it's so cold and I hate to have to cancel last minute because of snow. So I know a lot of our northern states are kind of in the same mindset. They don't do as many in the colder months because we're afraid that we might have to cancel it because if it snows. Da, 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 da. Sarah says, hello, how are you? Hello, Sarah. Do you have any advice on pursuing a coding certificate and working on the insurance end? So yeah, I think that would be a great option. I don't think you need to go through an entire college degree. That's one of the things I love about medical coding is that you can get like a certificate program, 6 months, 9 months, and be done. As far as working on the insurance end, yeah, what I would start doing is looking for those insurance specific jobs and see what are the requirements they're looking for. And then, like if the insurance companies, like if you want to work in person and they are hiring a lot of people that need to have skills in Word and Excel, that you need to know that if you don't have those skills, that you need to take some courses on that. So look for exactly what it is they're kind of targeting for their employees and build that into what your learning plan is and make sure that information is also in your resume. When you start retooling your resume, that you have that stuff in there that that the insurance end is looking for. Jamie King coming in with the super sticker. Thank you so much, Jamie King. Greatly, greatly appreciate that. Is it easier transitioning from risk adjustment to medical coding or vice versa? So risk adjustment is a type of medical coding. So we have different types of medical coding. There is professional fee coding where you code in CPT, you code in ICD-10-CM, and you code in HCPCS. In risk adjustment, you just use ICD-10-CM. So you don't have to worry about CPT, HCPCS, PCS coding if you want to just work in ICD-10-CM. I think it's a great starting point for a lot of coders because if you're overwhelmed by CPT, you don't want to work a lot in maybe procedural coding, you can just focus on risk adjustment and work in ICD-10-CM. There are a lot of jobs I've been seeing posted recently in risk adjustment. Some of them are project-based or contractual. We're seeing a lot more though now on the provider side as well because there's so much on their contracts being built that they will receive extra incentives, bonuses, increases in their pay based off of all these different performance measures, part of which is capturing that they have these very sickly patients, that they're taking good care of them, but capturing the severity of the illness of these patients using their diagnosis codes. So that's becoming a lot more prevalent. I'm seeing, especially in my area, and I'm sure across the nation as well, they're developing teams of people that are working in healthcare organizations, focusing on that ICD-10-CM section because of how much that impacts the risk adjustment and those payments. Let's see, what else? A couple of questions came through with my form submission. So this one says, hi, Victoria, what is the last day we can use the 2021 books in the exam? So if I wanted to take the CPC exam in March, do I need to bring the 2022 books with me because I have been using 2021 books in my community college and I want to do the exams with the same year book? Also, what do you think is more difficult, CPC or CCS? So let me answer the first question. So if you go on to the AAPC website, it'll tell you a little bit about the expectations as far as the books. So let me see here if I can. I always Google the FAQs, but let me see if I can find it just by navigating the site. Here we go. FAQs, certifications. So it tells you here about what year's books that you should use. So the books for the AAPC are based off of calendar year. So January 1 is when they will start changing the exam to meet for that calendar year. Even though ICD-10-CM codes changed October 1st, those codes aren't going to be in the exam until January 1 because that's when they change the exam. So you should bring the updated books for the calendar year in which you're sitting for the exam. You know, with the AAPC, and this is probably true of any organization, they're not going to want to rewrite the entire exam just because we got some new codes. So if everything that they had from the prior year is still accurate, they're not going to actually update much of anything. Chances are good we're going to see some small changes. Maybe if they have a question in their question bank that pertains to depression. Well, there was a code change now that depression, October 1st, it used to default to depression, major depression single episode. Now there's an unspecified depression code. So if there's a question in the exam bank where it talks about depression, they're going to tweak that answer and make sure that that's up to date. But they're not going to go through and be like, let's make 50,000 new questions because we had code changes. Because, like anyone else, they don't want to have to, don't want to have to break or fix something that's not broken. So we're only going to tweak what we kind of need to tweak there. So what it says is to bring the current years for the calendar year that you're sitting in. You can use the previous year. So if you're someone who's like, I just don't have, 10, 20 hours to rewrite the extensive notes and highlighting that I took in my exam, and I'm just going to maybe write in some of those code updates. I'm going to take a chance that maybe they might ask me a question and I might not have the right code for that one particular update. You can use your previous year's books. That is acceptable. Letitia's coming in here. Letitia Lake says, happy Saturday. Love your information. Thank you, Letitia. I'm glad to see you in here today. Jenny is asking, what is the best program to understand how HCC coding works and gets paid? So I have a couple of recommendations. So I do have a video that talks about, I think it's either risk adjustment or just I think I talk about HCC coding. So it is yeah, so I do have a video that you can watch for free that talks about HCC coding, what is risk adjustment, and it talks about the credential. I also do courses that prepare for the CRC credential. I don't do like the broad general medical billing and coding or CPC prep that a lot of instructors do. I have some organizations I've been working with to get some more offerings like that because I think the influx of requests I would get would be a little bit hard to manage without having to hire a lot of staff. So I'm working with some organizations to possibly get something together to refer everyone to that I kind of have custom worked with. Victoria Mendoza is coming up. Do you do tutoring? I currently don't do tutoring only because of the fact that I would not be able to offer tutoring at a price that would be appropriate for people who are just learning coding. So because of running my own business and doing all of my courses and the YouTube channel, to take an hour out of that time, it would have to replace the income that I would usually make making videos and stuff. So I would have to charge way too much, unfortunately, to do tutoring. I do have some resources that I can suggest to you. So I would say maybe check with tutors.com. They have a lot of tutors on there for medical coding and for medical billing. The other is Wisent.com. I actually, let me bring it up on here. And I think I do have it linked in the video description too. But you can this is a website where you can find tutors online and they can do even like Zoom sessions with you. So if you just type in medical coding, they can help you find tutors specifically for that. I think it might even work too if you're just doing like CPC. So it'll take you through like, do you want someone online, your time zone, and it'll help kind of pair you for what would be best for you. So it'll help find you matches for tutors. I really do need to find, I know a couple of people and I can never find their information when it comes up. That I do. Oh, there's Teresa. Alice, look at that. See, there's lots of people available. But tutoring can be expensive, and unfortunately, it would just not be super cost effective for what I would have to charge. Renee is asking, will I do a video on acute hospital outpatient modifiers? It's not on the target right now, but actually I do keep a giant spreadsheet basically of all of my different content ideas. So I will definitely add that in like right now as I'm thinking about it so that it's on the docket of something that there is interest for. So yeah, if anyone's ever interested in me doing a particular video, just let me know. And then I add it on to my list of content ideas. So acute hospital outpatient modifiers. I actually think I might circle back now and do the ICD-10-CM updates because so many people covered them. I'm like, oh well, who needs me to cover them too? But then everyone was like, Victoria, we need we need you to cover them, and I'm like, okay. So Carrie Lynn is asking, are your 2020 videos still accurate since the guidelines change often? I watched your 2020 E&M videos last night. So here's what you need to understand about evaluation and management coding. So we have 2021 guidelines that changed for E&M for office and outpatient visits. So codes 99201 through 99215. Those guidelines have changed. We still use that same E&M coding methodology, at least for now. It might change in 2023, but we still use that history exam medical decision-making methodology for basically everything else where we calculate an E&M. So if we look, for example, on our 2021 code book, where's my document, Kim? There we go. So if we look at our code book right now, all of our other E&M stuff has basically stayed the same. So E&M time. Let's see here. Here we go. So our office or outpatient services, those are coded just by medical decision making on the new criteria. Everything else here, our hospital observation, our inpatient consultations, ED, everything else that calculates on history exam medical decision making still goes by the older guidelines. So those 2021 videos would still be accurate in those cases. It's just that this particular section right here, starting January 1st of 2021, had new guidelines. Everything else is pretty much the same. Gemma, you took your exam. Gemma. Gemma took her exam. I'm excited. So it says that it takes 5 to 7 business days for the online exam. I know last time I looked, it was usually sooner, and I heard a lot more people saying it was sooner for online, unless maybe they're behind because of something that's going on with the AAPC. I will cross my fingers for you that it is not 5 to 7 for online, and that it's probably closer to maybe 24, 48 hours. Did you take both sections already? Let me know. Yes, thank you, Marissa. I did my nails black for Halloween. You know, it's just that time of year where you can kind of get away with it, I guess, and not get quite the odd looks of having black nails. I feel like I dropped the ball because I'm not doing a Halloween video. But I did one last year, and I don't know how many more codes I could come up with for Halloween. I probably could, but I really, what I want to try and do, and I'm still templating out because I use a template when I make my videos, is doing something on breast reconstruction, because I used to do a lot of plastic surgery. I know a lot of different resources about breast reconstruction coding in plastic surgery. It's Breast Cancer Awareness Month. So I think that might be what I'm going to maybe do for next week. Oh, Abigail's saying she took hers online and it took about 2 to 3 days. So yeah, I don't know. We'll see. Like I said, fingers crossed for you. Alma is asking, good morning. Currently attending coding school and is wondering if you have any suggestions on how to annotate the coding books to help get to the exam answers faster. I do have some videos on tabbing. If I were to give you advice, though, on like highlighting and writing notes, there's 2 big methods that people use for that. BAT and Chun. I think they do have videos for them for free on YouTube. I know Cco.us has a big, what they call the BAT cave, where you can access all the different information that they have on how to notate your books the best and like most involved way. Not everyone needs it notated and highlighted to that high of a degree, but it's good to see that methodology and see what you can abstract from it. So BAT is BHAT. That is trademarked, I believe, by Cco. And then there's Chun, CHUN. So I would check for those on YouTube. You can probably find some videos on the methodology. I can't off the top of my head remember who has Chun. I want to say it's AMCI, but don't quote me on that. Any wound care advice? Yeah, so I have coded wound care quite a bit in the past, mostly the pro feed side, not the facility side of the wound care clinics themselves. You're going to have to make sure you're very careful with your sizing. That's the biggest thing. So making sure, first off, the depth is correct in the sizing. And with the depth, one of the things that providers struggle with is they'll say things like, I went down to the fascia. Well, down to doesn't mean you went into the fascia. And the codes for the fascia mean that you have to have removed fascial tissue. Same thing for subcutaneous. I went down to subcutaneous tissue doesn't mean you removed subcutaneous tissue. It means you're like right on top of it. So making sure that providers are clear on their documentation, what level of tissue that they actually removed. Second is the sizing, because the sizing for wound care with the different grafts and flaps, they're all different sizes. So you have to be really careful about your square centimeter calculation. So if a provider says it was 10 by 10, that's 100 square centimeters, but then the units are billed by 20. So how many units are we going to bill then based off of that? So there is a little bit more mathematical calculation that tends to go in things like wound care coding because of all the sizing, flaps, and grafts. And then even if we look And I'll see if I can kind of show you some of the different codes that I've worked with in the past in wound care in the integumentary system. Let's see here. That's pre-malignant lesions. There were inner breast codes, blepharoplasty, flaps and grafts. Okay, so let's look at some of these skin graft codes here. So if we're looking here, we can see, and I'll zoom you guys in a little bit here. If we look at some of our codes over here, these are applications of skin substitutes up to 100 square centimeters, and this is for the first 25. There's ones over here that are 20 square centimeters. There's other ones that are based off of 100 square centimeters. So they don't all follow the same methodology. So you have to really, really, really be careful about all of the different sizing and calculating it out when you're doing all of that wound care coding, because it can trip you up really easy. That one split thickness of the same area is not the same unit square centimeters as a full thickness of the same area. So Devin's asking, if a PCR strep test is done and the results come back negative, can acute tonsillitis be the diagnosis with the strep test? It depends on the provider documentation. So remember that our ICD-10-CM codes are based off of the provider documenting that diagnosis. So unless the provider specifically wrote down in their documentation acute tonsillitis, we can't assume based off of any test results that that equates to a diagnosis. As a coder, we're not allowed to diagnose patients. So we can't just say that that is necessarily the diagnosis. Even if it's, a patient has a pregnancy test and it comes back positive, that provider has to state that that patient is pregnant. We can't infer a diagnosis based off of test results. Brenda's asking, is there an index to your videos? I find I am bouncing around and would like to focus on the order a bit more. So one thing I can recommend, I do have some playlists put together for focus on specific areas. Let me just get over here. Because every time I click on the playlist, it also shows like the videos that I liked and like my secret personally for me playlists. So let's see what we got here. If we go to, here we go. If we go to the main channel page, there are some that are organized appropriately. So like if you're just someone who's starting out, you want to feel if medical coding's for you, you want to know about what is the job going to entail, what are the salaries, a little bit of some introduction. This is the like start here playlist. Down here is my CPC exam tips. So if you're going for your CPC exam, this is going to be the playlist you'll want because it'll take you through all my exam tips. And I'll probably do some updated ones then for 2022. And then these are just popular uploads. E&M coding. I have a whole series on E&M coding. So if you're looking to learn E&M, there's a playlist for that. ICD-10-CM guidelines are a whole playlist that you can just watch on through. This is my CPC review. So this one goes chapter to chapter to chapter to chapter to chapter, kind of in the same order as the CPC curriculum does. And then there's just one for all the different shorts. I'm just looking at this and kind of laughing because as I show my screen, it also shows like what all of my subscriptions are. And if you'll notice, like none of them are medical coding. They're all like they're all like Disney's channels because that's just been my thing anymore. I have to watch my basically Disney and Bailey Sarian, I think is what I'm watching right now. So I have another question that came through on the form, and I want to make sure I get to some of the questions on the form. Oh, someone had asked me, I almost forgot part 2 of one of my earlier questions. What exam do you think is more difficult, CPC or CCS? I've only taken the CPC, so I can't do a personal comparison of the CCS, but I would think that since there are some components of the CCS exam, from what I understand, that are not multiple choice, to me, that would seem like it's a harder exam. Some people will say just the opposite. They'll say they think the CPC is more difficult. Although I think the CCS is less time consuming. I don't think it's as long of an exam as the CPC. I'm currently enrolled in Penn Foster, brand new to coding. Would you recommend this program? For liability purposes, I don't really recommend any programs. I don't tell anyone to go to one program or the other, or not to go to certain programs, because I don't want to wind up in particular situations where I'm being told that I preferred a certain organization, or I've told people not to go to. So I don't provide one-on-one information on specific courses, although some of you in the chat might be former students, and you're more than welcome to talk about that. Mallory's asking, how did boot camp go? Awesome. I actually have my next boot camp coming up. So if you are someone who's interested in earning a CRC credential, the Certified Risk Adjustment Coder credential, and it is you already know ICD-10-CM, or you're already a CPC and you're looking to get it as a secondary credential, or if you know ICD-10-CM, MedTerm, you're kind of looking for an accelerated program, I am offering what I call the November night school. So instead of doing weekend boot camp in November, we're going to do an evening one. And that is currently open. I think tomorrow might be the last day for the coupon for it. So let's see here. Yeah, tomorrow's the last day for the deal. So the CRC boot camp is $399. You can use code November CRC, and that'll take 20% off through the 24th. So we're going to have it November 8th, 10th, and 12th from 7 p.m. to 9:15 Eastern Standard Time. And that's basically just going to focus on an abridged version of the CRC curriculum. So we're going to skip past all the parts where we're just talking about the business of healthcare, where we're talking about general ICD-10-CM, like how to look up a code. We're going to skip the basics, go right into what is risk adjustment, what are the different models, the things that are more prone to be on the exam, like what are they going to test you on? They're going to test you on COPD. They're going to test you on asthma coding. They're going to test you on a lot of diabetes. Like we're going to focus on the stuff for the exam. Destiny's asking, did they fix the issues relating to the clinical documentation risk adjustment books, like not providing answers to chapter questions and some pages being blurry? I haven't heard about that. Are you talking about the AMA one, like the Sherry Poe Bernard one? Because I have the original version of that one, but not the second edition that came out. So I'm not sure too much about that. Clinical risk adjustment, yeah. I don't know. Can you take the exam online? The Cpc exam I know is currently being offered online. I'm not sure that Ahima is offering anything online right now, at least not that I've heard. I'm not up to date on the latest with what Ahima is doing. I know the Aapc has considered putting other examinations online. I think they might still be in process of that. I think there's a lot going on and they're weighing all kinds of different options. So I couldn't honestly say if like others are going online, but I know definitely the Cpc is online, at least in the United States setting. Other countries I'm not 100% on. And that's not going to be taken away. It's not like, they're going to say, oh, well, the pandemic's over. We're only going to go to in-person testing. They're going to be keeping the Cpc exam at least online. Do I have videos on coding for radiation oncology? I have done like that much rad-onc, like that much. So unfortunately, I don't have a lot on radiation oncology. If I get to a point where I can speak pretty well versed on it, I will definitely make some videos on that. What do you think is better for learning E&M, CPMA or CRC? So the CRC is just ICD-10-CM, so there wouldn't be any evaluation and management coding for that. So I would definitely say the CPMA. There is actually an Aapc credential specifically for E&M coding. It's called the CEMC, I believe. So it is, let's see here, under their specialty certifications. So that one is just for E&M coding. So the CEMC, and I think they do have training for that. Let me see if they do, because I know some of the certifications they have online training for, others they do not. Let's see here. Specialty, locate, prepare. Okay, locate, schedule. Yeah, this one they might not. If you're actually interested in learning more about E&M coding, I do have a course that is good for that. It is on my website here. Yeah, evaluation and management, calculating the level. So that goes through the history, the exam, medical decision making. We go through case studies. It's like a amped up version kind of what I have online. It's not the same. It is entirely different and much more involved discussions about that. And then it also goes over the 2021 guidelines with case studies as well. And if you're interested ever in getting your CPMA, I do offer the full CPMA course. Now, of course, the CPMA is an advanced course. It's not for someone who has no exposure to medical coding or no exposure at all to the process possibly of auditing. So that is available on my website as well. It's on demand, take it at your own pace. It has CEUs, and there is an FAQ that talks about like what other materials you'll need for the exam, etc. And it does talk down here about the course curriculum too. And if you're someone who's ever interested in purchasing like one of my specialty credentials or courses, and you're worried about the tech, like, am I going to be able to get this to work? I do have a couple of free courses available. If you just click here, this button that says free. And they offer CEUs too. So if you need some CEUs for the AAPC, these each offer one free CEU. So you could subscribe for these for free and just like test them out and see if it's the right format that'll work for you. Do I have any videos on, oh, wait, here we go. On oncology or hematology? I don't think I have too much on hem-onc. I've done some hem-onc in the past. And I could probably put something together, but it's been a minute since I've done hem-onc. Do I have any info on Profi urgent care coding? I have a case study on that. I do have one. Let me see if you can find it just by typing in urgent care here. Let's see here. Oh, I don't. I'm thinking of the emergency department one that I have. I don't have urgent care. Yeah, I could put something together eventually about urgent care coding. That's not a bad idea, because it is different, a different nuance than just talking about E&M in general. Yeah, the second edition of the Sherry Bernard Clinical Documentation Risk Adjustment book. Yeah, so I honestly didn't hear anything about the issues with the second edition. But if you get the book from like an Amazon or something and it turns out that the book is faulty, like there's pages missing or something, I would definitely follow up then with like Amazon about it. But I hadn't heard anything about there being any kind of issues with that particular book. For my course, the study guide is usually really good because that focuses really on what the exam itself is going to be covering. So that's one. What's the link to the free CEU? So if you go to contempocoding.com, and then what you'll want to do here. So if you go to contempocoding.com, and then you go to the courses, there's a little category here where you can select free, and those are all the courses and free CEUs that I have available. I do also have some CEUs that I offer just to channel members. So if you're ever interested in joining the channel membership, it is a tiered fees that I have. If there should be a video at the bottom of the YouTube that allows you to join channel membership. As a channel member, you get custom emojis, you get community only posts. At the $4.99 and $9.99 level, you get your name added to the end credits of my videos. And at the $9.99 level, you get behind the scenes footage and some outtakes that I post periodically to the community. So if you're ever interested in joining the channel membership, there is information on that in the video description. I actually also have other ways if you're interested in supporting the channel. They are listed as well. So if you want to maybe buy like this shirt that I have here, that's available on the merch shelf. I also have my turkey tea. If you're not familiar with the merch, and there's still time to order the turkey tea, but you want to order early because you don't want to wait too late and then not have your turkey tea. But I have this, it's been super, super popular right now. So these are the turkey teas. So I have the sweatshirt, the regular shirt, the V-neck, and then someone asked to have it put on a hoodie, and it is very cute. I personally kind of like the V-neck. Which is the same kind of as cut as like this one that I have on. And it's struck by a turkey. And that's the code for it, W6142XA. So you can find that in the video description as well. Barb's asking, do you know if there's a PowerPoint for the new changes for 2022? So I don't know any PowerPoints. I know there's been some organizations that have done some free stuff. I'm sure CCO has put something together. They always do. But I'm planning on putting something together still for ICD-10-CM because I've been asked to do that. And I am putting something together for the 2022 CPT changes. I have the listing of all of them. I just need to get them together. I usually like to do that in the November timeframe because I don't like to do all the CPT updates too far in advance before when they're actually going to be implemented, but you want to have time to prepare for them as well too, right? Renee, as far as your hernia, I would have to research that first. So there's a form in the video description. So if you submit your question via the form, I can research that and look back at it next week. But off the top of my head, I can't answer like involved coding questions for a lot of things like procedural coding. Sandy, I do have, you know what? I do have one video, I think, on ED coding. So if you're talking about ED as far as like levels of service, I can do, I do have that E&M playlist on the website. So we have here, boop, 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 boop. No, don't do that. It's going into my stuff. Here we go. Oh, no, I don't want that. Let's go to your channel. So if you're talking about, if you're doing ED coding where you have to score the E&M service, I do have the E&M playlist available. And that is here because ED coding is still based off of history exam medical decision making. And then I think I do have one ED video where I do a case study. Let's see here, emergency department. Yes, medical coding case study, emergency department, E&M. So those are the resources that I have right now as far as ED coding. As far as what education that will give you just a leg up in general, I feel like the Aapc, this is another one that I know they have certification for. I don't know that they have training for it though specifically. Let's see. Specialty certifications, CEDC. They have approved references, renewal FAQs, prepare for the exam. Here we go. Ooh, so they do have a preparation course for emergency department coding for their certification. So that might be something that you could look into, or even just getting the study guide that they have available for the certification for the emergency department. Vanessa's asking, what's your take on traumatic wounds in a diabetic patient? Would you call them diabetic ulcers? So it depends. I believe there is some assumed cause and effect relationship for diabetes and ulcers, short of pressure ulcers, because the cause of a pressure ulcer is the pressure, obviously, and not the fact that the patient has diabetes. So if we look in our ICD-10-CM book for diabetes, we do have the assumed cause and effect that we can make without the provider documentation. Hold on. Got my 2020 book here yet, which is brand new. I've barely cracked it yet. So here we go. So we have some assumed cause and effect relationships between diabetes and anything that appears under the term with in the alphabetic index. So if we look here, diabetes and ulcer, I believe we have foot ulcers are assumed to be diabetic foot ulcers. And I think a skin under here maybe too. Let's see. Ketoacidosis, retinopathy. Wait. Going too far because now we're due to drug or chemical. Diabetes with skin ulcer, E11.622. So if it's traumatic ulcer, traumatic wounds in a diabetic, would I call them diabetic ulcer? I don't think I would call them a diabetic ulcer because I don't think the ulcer would be necessarily caused by the diabetes, and it's not something that I think would be assumed cause and effect if it's a traumatic wound. But it would also depend on the provider documentation and how they're kind of wording it. I know some providers are not always the best with keeping consistency between it's an ulcer and then it's a wound, et cetera, which does impact the code selection, unfortunately. Brian Simpson coming in with the $9.99. Is that a super chat or a super sticker? Why is it not showing appropriately on my thing? But thank you, Brian. Greatly appreciate your support. Can I do a video on CVA diagnosis coding? CVA diagnosis coding, I can. I don't know that I could fill like a 10-minute video on it, but I probably could fill a short video with that. So let me add that on, CVA coding. I'm going to add that onto my content list. Thank you, guys. Excuse me. I have another presentation I'm trying to keep an eye on because I have a 4 o'clock at Piedmont chapter. I think I'm doing a presentation on auditing. Ray 108 says your content is really helpful. Keep up the good work. You deserve more subs. Thanks, Ray. I do greatly appreciate that. And thank you so much for the sweet, sweet comment. Let's see. Let's go back to the form. So I have a question that came through on the form. Do you have online classes or a website like Aapc, which is extremely expensive? I do have online classes, but I currently only do prep for the CRC exam and the Cpma exam. Like I said, I got something in the wings that I'm working on for people who want like that introductory course that I'm actually working with onlinedegree.com. So if you're ever interested, if you haven't taken any courses yet in medical billing and coding, I do have an affiliation with onlinedegree.com. And basically what they did is they developed a quiz that is the same questions I would typically ask you. Where are you located? How much money do you have to spend on your course? How soon do you want to be done? And they can help pair you up with an accredited school. So it's not like they're going to pair you up with some instructor that's, going to close up shop in 2 weeks, or someone who isn't going to appropriately prepare you for the exam. So if you're interested and you're just starting out, you can check out onlinedegree.com. Again, if you will get a potential discount or some extra features if you use the quiz that I have there, go to onlinedegree.com/contempo. And I will disclose that I do have an affiliate agreement with them. So I do receive compensation for people that subscribe to that and wind up going through education through them if you sign up. No. Oh, thank you guys. I really do appreciate it. Hey, this is what I love to do. Maximus the Clone says, I'm passing my practice exams with an 89 to 92% each time. That's awesome. However, I'm afraid the actual test will be nothing like the practice exams. Can anyone confirm or deny my fear? I think the practice exams are pretty close. So from what I understand, I've talked to some people who have worked on some of the curriculum for AAPC in the past. And from what I understand, what they basically do is they get a pool of people and they go, "Hey, everyone, we're going to make some CPC exam questions," and they just make a whole bunch of questions. Then the people who are generating them don't know if they're going on the actual exam, a practice exam, in the book. A study guide. So they just have this pool of questions. So it's not like they're targeting questions to go on the exam. They're like, haha, we're going to make these the super hard ones. It's just generally just a giant pool of, of practice questions, and they go all over the place. So generally speaking, the practice exams, they're pulled from the same pool that they pull everything else from. So reasonably, they're going to be very, very similar. If you're getting like an 80% on your practice exams, it's a great indication that you'll do well on the exam. So I would highly recommend that you go ahead and sit down for that CPC exam. Man, time is flying through. So I have a question that came through the form. It says, I am considering becoming a medical coder. I have a master's degree in clinical social work, and I have interned in a hospital. So I've already taken courses in anatomy and physiology and pharmacology, so I have a good grasp of medical terminology. Will this experience and training make it any easier for me to get a job after getting certified when I have no experience as a coder? Will my previous experience and training make me more desirable employee? And do people who are over 50 have trouble getting hired? Sorry, I know this is more than one question. Thank you. So I think if you've had any kind of prior exposure to medical terms, to drugs, to anatomy, that will definitely help you in your preparation for training in medical coding, because at least you've kind of already gotten over that one hurdle. You're still going to need to learn those code sets, ICD-10-CM, CPT, and HCPCS, but you'll be that one step ahead. I think it might be a good thing you can highlight in your resume to show employers like, hey, I have experience in healthcare in the past. I've done clinical social work. You might be more familiar with documentation and how to navigate it, how it's created. And that is something you can definitely promote when you're just having those discussions with potential employers, things you want to highlight in your resume that you've had prior healthcare experience. So I think that will definitely be a feather in your cap in that manner. As far as the second part of the question, do people who are over 50 have trouble getting hired? I don't think so much anymore. It's not something I've personally had to deal with. I as an employer, have never put that into consideration when I was hiring medical coders, when I was previously in a management role. My former mother-in-law actually, I think, passed her CPC in her 50s, and had worked, I think, in some charity organizations in the past, had some familiarity with healthcare, and didn't really have a lot of trouble finding a job. I don't think that the fact that she was of that age prohibited her in any way. And I have heard quite a few coders. I've had actually quite a few people come into the chat that tell me that they're like 65, 67, and they're just starting in medical coding now. So I don't think there's any limitations as far as I'm concerned with the age groups. Let's see. What books are allowed for the CPCO exam? They changed this recently. So let me pull up the AAPC website, because I know they did make some tweaks on this recently. For the CPCO, so for those of you who aren't familiar, the CPCO is the Certified Professional Compliance Officer through the AAPC. So if we look here, I think it is, let's go to our certification, and then we're going to go over to our FAQs. So in the FAQ section, let's see, what items will I need to bring to the exam? And then here's their approved resources. So they have this for basically every certification that they offer. So here we have Certified Professional Compliance Officer. You're allowed book and references number 12 and 13 out of this list. So here would be 12 is the OIG supplement, OIG compliance plan, the OIG program guidance. So all the OIG stuff, you can print that out and bring that to the exam. You are not allowed to write notes on the blank sides if you print them out one-sided, just on the printed sides. And then it says the AAPC reference guide is allowed, so number 13. So there's a difference between the reference guide and the study guide. So I'll show you where that is on the website. So if you go back to the AAPC website, and I'll flip over here so you can see kind of what I'm doing a little bit better. So here's our books and software, and they have certification study guides and they have reference guides. So the reference guide that you're allowed to bring for the exam is the one here. So under this book software reference guide, you're allowed to bring the compliance one. So HIPAA, non-physician. Yeah, here we go. Physician practice compliance reference guide. So that's the one that you're allowed to bring for the Cpco exam. So again, these reference guides are different than the study guides. So I know some people get confused. They want to take the study guide along, but this is actually different. So you can kind of see they have a different design on them. The study guides, certification study guides look different. So this book is not allowed because this is the study guide. The reference book is the one that's allowed to be brought along. Yeah, we have someone here says that they were certified at the age of 50 and they're now working remotely for a medical center. So that's awesome. 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 Ashley says, I am currently a student and my professor has stated that we need to choose an organization. Who would you recommend, Ahima or AAPC? Either are going to be amazing. Either one are phenomenal. I personally just have AAPC certification, so I'm a little bit biased towards them. I think they have easier to find CEUs. I think it's easier to get AAPC CEUs. There's more community, I think, with the local chapters with AAPC. However, if you want to get into inpatient coding, you want to code inpatient facility fees, most of the employers are looking for Ahima credentials through that. So that would be the big different considerations. I'm a non-science background, so which book is best for anatomy where easy language is given? I think I have it listed in my video description. If not, there is a book on anatomy and MedTerm that is great for coders. Hold on one second. Trying to find it on Amazon. No, it's called Medical Terminology for Coders. There we go. I believe they're on the 4th edition right now. Where is it? Yes. So this book is the one I recommend. It is Medical Terminology and Anatomy for Coding. This, I think, is the 3rd edition. This is the more updated one, the Medical Terminology and Anatomy for Coding. So that would be the book reference that I would highly suggest utilizing in order to learn MedTerm and anatomy. And the great thing is it compares it to how that is incorporated then, specifically for medical coding, not just like ICD-10, but CPT, PCS, NCM, and our HCPCS coding as well. Do I personally prefer using coding books or Codify? I prefer my coding books. I'm just more familiar, I think, with how to navigate them. And I feel like I can't navigate Codify as well. I love Codify for other things, like for checking CCI edits, for looking for lay descriptions of video of CPT codes, but not just for general code lookup purposes. Although I am testing some other things out that I think I might be recommending as far as code lookup tools. I actually even have the ebook version of the CPT book, and I really don't use it much unless I'm literally copying like an excerpt from it and putting it into a PowerPoint for a reference. Oh my gosh, it's almost 3 o'clock. So I got one more question. Letitia Lake, I am studying to become a medical coder. Any study tips? I have tons. I have tons of study tips. So if you go onto the main channel page, you want to go check out the playlists that I have available here. So I have When you get to the section about ICD-10-CM, I have a whole section about the ICD-10-CM guidelines. I have a whole section about E&M that has been like super, super helpful for people who are trying to understand that. I actually have, I've actually had a couple of colleges and universities reach out to ask if it's okay to link to some of the E&M videos because they found them so great to supplement some of their online education that their instructors are doing. And then I have a lot of reviews based off of each chapter that you're going to want to check out as well. So those are really, really, really helpful. Okay, so I want to thank you all for coming in here for me for another weekend. I should be back next weekend. Let me check my calendar. Yeah, I should be back here next weekend. I will see you guys next weekend or in my next video. And until then, just keep on coding on.